This procedure uses heat-free high-velocity water jet to precisely remove prostate tissue, that is, based on a detailed surgical map. Another minimally invasive procedure is called prostatic artery embolisation. This procedure, also known as PAE, is normally done by a radiologist. In this case, tiny particles are normally injected into the arteries that supply the prostate. In the process, this procedure cuts off the blood supply, and in the process it shrinks the prostate. Now, the next type of procedures that we are going to discuss is traditional surgical procedures. These procedures are typically designed for patients with very large prostates. They are also applicable to those ones who have not responded to other treatments and are also more effective and durable. An example of traditional surgical procedures involves transurethral resection of the prostate. This procedure is normally considered to be a historical gold standard. This procedure involves inserting an instrument into the urethra to trim away excess prostate tissue using electrical loop. Another traditional surgical procedure is simple prostatectomy. Now, for cases of massive prostate enlargement, the inner portion of the prostate gland is normally removed through an open incision or laparoscopic or robotic approach. You need to know that this procedure differs from radical prostatectomy. Radical prostatectomy normally removes the entire gland to treat prostate cancer. The ideal procedure depends on factors such as the size and the shape of the prostate. Other factors include severity of the symptoms and the patient's preferences, potential side effects including side effects on sexual function. Now, surgical procedures that are done for large prostate includes HOLEP. HOLEP means Holmium Laser Enucleation of the prostate. Now, this is a widely recommended and minimally invasive procedure. In this case, a laser is used to cut off, that is to enucleate or to peel off the excess tissue from the capsule, which is then removed from the bladder. In this procedure, we use a Morse letter. Now, the main advantage of this procedure is that it can be used on any size of the prostate. The procedure also can lead to less blood loss and lesser hospital stays as compared to other procedures. Now, this procedure also provides a tissue for further analysis. Now, the consideration for this procedure is that it requires a specialized expert. Another surgical procedure for large prostates includes simple prostatectomy. Simple prostatectomy can be open or robotic assisted. This involves surgically removing the inner core of the prostate gland. The open method is a traditional approach for very large prostates. It normally involves incision on the lower part of the abdomen. The robotic assisted is less invasive as discussed in the above. It involves smaller incisions, less blood loss, and a shorter stay in the hospitals. The main advantage is that it is highly effective for enlarged prostates. It can address other issues simultaneously, such as larger bladder stones. Now, the consideration that you have to make is that you need to know that it is more invasive than transurethral methods. It involves a longer recovery time with a higher risk of bleeding. Another surgical procedure that is done on large prostate is photoselective vaporisation of the prostates. While sometimes it is less effective for very large prostates as compared to enucleation methods, high-powered lasers can vaporize tissues and are a good option for men taking blood thinners. That is due to minimum blood loss. The choice of procedure depends on several factors. That is the specific size of the prostate, the overall health of the patient, and also a patient's preference regarding the potential side effects. It is important to discuss these options and potential outcomes with a qualified urologist.